This morning in our series, Vaccinating America, we're answering your questions about vaccinations and the projected holiday surge in COVID cases. CBS News Chief Medical Correspondent Dr. Jon LaPook is joining us now. Jon, good morning. Good to see you.
Good morning. Happy New Year's Eve, Vlad.
Happy New Year's Eve. So, Jon, 2 states have now reported cases of the new, more contagious strain of the coronavirus, first reported in the UK. Is it your estimation that that strain of the virus is already here in the United States, given that we've already seen it in 2 states? And more importantly, will the current vaccines approved work against it?
Vlad, I think it's highly likely that it is much more widely spread. We just haven't been looking for it. Now that we're looking for it, we'll find it. The good news, and I confirm this with Tony Fauci, is that the vaccine is still expected to work on it.
Doc, let's talk about the AstraZeneca vaccine, approved in the UK. How does that compare to Pfizer and Moderna's vaccine?
You know, David, it works on the same mechanism of trying to sneak in some genetic material that codes for this spike protein and to get your body producing it. And that protein then acts sort of like a scent would for a bloodhound and then trains the immune system to go out and be ready for an infection. In this case, it's using a virus called an adenovirus. You put DNA in it, it goes in, it attaches to cells. The trick, though, is that the adenovirus has been altered so it can't multiply once it's inside you. It's just another way of getting genetic material inside. And it's the same kind of idea.
All right, Doc, let's get to our viewer questions. Elizabeth on Facebook asked this: how will we know when we can get the vaccine and where to go to get it? I think a lot of people, that's probably the #1 question I hear, Jon. I mean, I know when my parents who are older in their 70s will get it, but for example, people who are not high risk or essential workers, what's the schedule?
Yeah, well, the CDC has put out a general guideline, right? So the first is the healthcare professionals, about 21 million of them, and also people in skilled nursing facilities, another 3 million. Then you go down to people who are frontline essential workers. That's in the 1B group, and people over 75. And then in 1C, you have people who are younger and also essential workers. And then after that, you work down to people who are, say, in their 20s or in their late teens. But the reason why everybody's so confused is that you've got 50 different states, and it's the states that control exactly the plan. So it's like you had a football game, and you had 50 different coaches and 50 different game plans. No wonder why people are confused.
Interesting. Let's go to an Instagram question, Doc. So someone asked, how fast can you gain immunity after you receive the vaccine? I have a friend here in New York City, Dr. LaPook, who is a doctor. He received his vaccine a week or so ago. 5 days later, he tested positive for coronavirus. So some people are wondering, I didn't think you could get the virus after you get the vaccine. What say you?
In the studies, it looks like the immunity starts to kick in at 2 weeks. So unfortunately, your friend at 5 days didn't yet have enough immunity. And then at 2 weeks, it starts building. And then, of course, the full immunity that was measured in the studies, at least, was at about 28 days, at about a month. So you start to get immunity about 2 weeks, a little bit too early at 5 days.
Interesting.
Here's a question from Joanne, Jon. Can a vaccinated person still transmit the virus?
That's the million-dollar question, Vlad, and we don't know the answer to that. We think it's likely that there should be protection against transmitting the virus, but they're still looking at the data for that, and there's an asterisk there. We're not positive, and that's why they're saying, look, even though you get the vaccine, you still have to wear the mask and do everything else because you're not positive that even though you're feeling fine, that you couldn't possibly transmit it to somebody else. We should find out the answer, hopefully in the near future.
Jon, you got your vaccine a week ago. How you feeling?
I feel great. I had about transient, the slightest of headaches, maybe for a day or two, a little sore arm, but I feel terrific, and I'm so happy to have gotten it. It was very emotional to get vaccinated, not just the relief, but also the release, I think, of all those months of what we've all been going through.
Happy New Year, friend.
Happy New Year, Dr.
Happy
Jon
New Year.
LaPook. Good to see you, my friend. Happy New Year to you and your family.